Let's talk about low back pain and medical imaging. So if you've ever hurt your back in the past, maybe you went to the doctor and they wanted you to get an x-ray or maybe an MRI. But what we're going to talk to you about is how sometimes actually getting imaging done can lead to negative results. Aging, it's just part of life. As we age, there's changes that happen to our spine and our body. But what's interesting is they've actually done medical imaging, x-rays, and MRIs on healthy individuals, as well as people that are experiencing pain. And they found some really interesting and some surprising results. For individuals that are around 20 years old, up to 30% of them had some disc bulges as well as some disc degeneration. Once you're in your 50s, up to 80% of people can have some degeneration and disc bulging. And then what's even more crazy is that when you're around 80 years old, almost 100% of people have some degeneration and disc bulging. What's really interesting is if you take an x-ray or an MRI and you put them up to a screen and then you ask a doctor which person has pain, you can't assume. It's almost a flip of a coin. Just looking at someone's x-ray, you can't determine if someone actually has pain or not. What's also really important to know is that medical imaging isn't cheap. It's actually really expensive. So if you were to have back pain and you want to get an MRI, that costs about $5,000. And words really matter. So if you sit down with a person and they're talking about your MRI results, your x-ray results, and they use words like degeneration, bulging, some words that you may not understand and sound scary, it can actually be correlated to worse outcomes. Medical imaging has its place and it can definitely save people's lives, be really important in some rare scenarios or for individuals that really need surgery. However, the best evidence is now supporting try physical therapy first, try self-management, self-conservative programs like this one to take care of your body and then preserve medical imaging for when things aren't getting better.